I'm incredibly passionate about rhinoplasty. It's one of my favorite procedures to perform and one of the procedures I think I'm best at. So rhinoplasty is a broad term that means to change the way the nose looks or functions. So some rhinoplasty is for breathing, so people that have deviated septums or collapse of their nostrils, we can fix that with the rhinoplasty. Some people have more cosmetic changes that they like, so taking down a big hump or a droopy tip. Anything encompassing a change to the way the nose looks or functions is a rhinoplasty. In general, a good candidate for rhinoplasty is somebody who's fully grown, and then just somebody with realistic expectations. There are a lot of different ways to do rhinoplasty, and I think maybe what sets me apart is that I can do all the different techniques. There's not one approach or technique that's the right for each patient or all patients. So I'm well-versed and comfortable with all different techniques and can choose exactly what the patient needs. The downtime depends on how much we have to do. So if we're just doing a small tweak to the nose, it may be pretty minimal downtime, just a few days. For most patients who need kind of a full rhinoplasty, usually looking at about 1 to 2 weeks. During that period, patients are not bedbound, they're not in that much pain, but they're just a little swollen, bruised. They may not want to go to an event, but then the nose will continue to heal. Swelling actually continues to improve up to the full year. So you really will continue to see incremental improvements in the way the nose looks and functions for an entire year. Post-op care for a rhinoplasty in every procedure is critical. So I like to see my patients frequently after surgery. I check in with them all the time to make sure that they're healing well. We're really fastidious with getting them good post-op care, wound care instructions, and we optimize their nutritional support so that they heal in an optimal fashion. My patients afterwards, one of the biggest concerns is usually just looking overdone. And my patients are usually really happy that their nose looks natural, matches their face, and looks harmonious and balanced. Anyone that might be thinking about a rhinoplasty, I would love to meet them and talk about them and see if this is the right fit. And I want to hopefully see you soon at NewSkin.